Good afternoon, ladies and gentlemen. Thank you so much for coming out today. It's great to see such a nice turnout. My name is Naomi Schaefer Riley, and I'm a resident fellow at the American Enterprise Institute. Here at AEI, we have a particular interest in understanding the ways that both government and civil society can help the most vulnerable individuals. And the 440,000 kids in foster care certainly fall into that category. Many of you may be wondering why the title of this event does not include the word pipeline, as in the foster care to prison pipeline. One reason I think not to start with such a phrase is that it presumes the inevitability of the outcome. Using the word pipeline, I think, so often leads to wrong-headed solutions and sometimes even policy paralysis. If it's a pipeline, the message has begun to filter down to even the young people inside of our systems, then your future has already been written. In a 2017 analysis by the Child Welfare Data Analysis Bureau at the California Department of Social Services and the California Department of Corrections and Rehab, they linked administrative data that were used to find the prevalence of child welfare involvement among inmates in California. 28% of inmates incarcerated between 2000 and 2013 had a history of either an open child welfare case for in-home services or an out-of-home foster placement. 28% is a very high number, but it is not the 70% figure that has been sometimes thrown around in other contexts. Today, I hope that our panel of experts will help us shed light on the relationship between foster care and the criminal justice systems and help us to answer some very important questions about how to help the young people who seem to be on this trajectory. So first today, we're lucky to hear from Laura Bauer, who has been an investigative reporter with the Kansas City Star for 15 years. She is the co-author of their recent series called Throwaway Kids, which I highly recommend to you. Then we'll hear from Rebecca Padot, an assistant professor of history and government at Misericordia University and the author of The Politics of Foster Care Administration in the United States. Next, we're going to be hearing from Sean Hughes. He is a managing partner in charge of government relations at Social Change Partners. They assist advocacy groups, public agencies, and direct service providers in child welfare and juvenile justice to help broaden their impact through local, state, and federal policymaking. And finally, we have Greg McKay. He is the Chief Operating Officer at Child Help USA, a nonprofit devoted to helping abused and neglected children. He is the former director of the Arizona Department of Child Safety. So after each of the panelists has a chance to give a presentation, we will have a discussion amongst ourselves, and then we will reserve the last 15 minutes of the event for questions from the audience. So with that, I'm going to turn it over to Laura. Thank you so much again for coming.
Okay. 12:06 start, right? Hi, she said I'm Laura, and I brought a crazy big cold from Kansas City with me, so you don't have to touch me. But and it's unfortunate because I'm not at my best, but I will try. I've been at the Star for 15 years, but I've been a journalist for more than 26. For much of that time, I've covered child welfare issues. First as a COPS reporter dealing with high-profile deaths, whether in foster care or in the family home. And later as an enterprise reporter looking at system failures in some states from high turnover rates, high caseloads. One thing I never looked at, and the Star had never looked at, and many journalists across the country haven't looked at, is the long-term outcomes for these kids. What is the future like for kids who are raised by the state? And so Judy Thomas and I spent a year doing that. And we looked at what this journey is from removal from the home to foster care to later in life. And what we found is there really wasn't a data set to show what that long-term outcome is. So we created one Judy and I created a 15 question survey that led to these stories. And in the survey, it was just asking about the inmates across the country, what their background was, and then what their time in the system was like. We ended up getting, in 12 states, nearly 6,000 inmates participated, and we found that of that number, 1 in 4 had been in foster care. And so Some will say that that is low. Our survey is not scientific in any way, and we made sure to say that over and over again, but it is a snapshot, and it tells you what life is like for too many of these kids. And so what was so interesting that Judy and I found is it wasn't just the 1 in 4 number. At the bottom of the survey, I don't think I have that, but at the bottom of the survey, they were able to write about their time in foster care and what that was like. We heard from hundreds of inmates that was really telling of how they felt that foster care changed them, how they felt that they longed to be with their family. They learned to distrust. They learned not to like authority figures. And so we really, from the 1 in 4, we learned something, but we also learned something from their own words. And so often these kids aren't listened to or aren't heard. Through the Kansas survey, that was the first state to sign on to do it. And one reason is over the last few years, Kansas's system is very troubled. They knew that the foster care system needs extreme reform, and they're trying to do that now. So everyone in the state said, yeah, sign us up because we know we need to improve. So we got 1,200 inmates. They surveyed every one of the facilities. Out of 1,200 inmates, 1 in 3 in Kansas had been in foster care. So that was one of the highest averages. The next highest was North Dakota, but the number was much smaller, but it was 42% who did the survey that had been in prison. But through the surveys, we met a young man named Dominic, and he had gone into the system when he was 3 years old. Older brother, actually, he was 4, had gotten out of the house one night and was running around the complex, and they had called police. And they had gone to the home to see what was going on, and they found mom's crack pipe on the table. Both children were removed. They were kept together. Mom said, I'll sever my rights if you keep them together. That didn't happen. Kansas ended up putting them in different homes. Older brother was adopted. Dominic stayed in the system, adopted 3 times, and in his words, thrown back each time. He learned to not trust. He, in those from 3 to 14, he had 80 placements, which we found across the country. That really isn't that alarming. Other kids have that many or almost that many, but Kansas does. And now they're under a class action lawsuit with the number of placements being one of the main things. And but what Dominic told us was that he felt that when he aged out of the system, he had nothing. And his comments were, I was thrown out when I was 18 and I became homeless. And I wrote down his exact quote, but that was basically what he said. And he said he felt like he had nowhere to go, so he turned to crime. And by the time he was 18, he had 6 felonies. When he was 18, he had 6 felonies. By the time he was 19, he was in prison for 8.5 years. And we in no way, Judy and I know that not everyone that goes into foster care is going to end up in prison, obviously. That is not what we found, and that is not the truth. And I think what Naomi said was, it's not a definitive, it's not inevitable that this pipeline exists and that this is where children are going to go. But what we did find is of the kids that we spoke to, they had said that when they aged out and they had no one, that they didn't know what to do. Most of them did not have a driver's license. Most of them had never had a job. They only got their Social Security card when they aged out. Everyone in their life, when they aged out, had been paid to be in their life. They didn't have those natural supports. So my son, 23, he's still in my basement, and we love it. And he's going to graduate from college soon, but these kids didn't have that. Another thing that Judy and I were totally surprised by was the education. Education is often at the door to success, and too often kids in care do not get the same educational opportunities of their peers. And so that was not on our radar, and we found Oregon has a graduation rate as low as 35%. For the general population, it's 77%. Kansas had 38.6%. The average was 87%. Kids like Dominic and Joseph and Kisa, they never graduated because when they're in high school, after going from home to home to home, school to school to school, they had 6 credits, 8 credits. You need anywhere between 21 and 28 credits. So that is one thing that I think since the story ran that people have been most surprised about would be the education. So our stories, started at the survey and showing these are the long-term outcomes, but also took the journey of how they got from being in foster care then ending up in prison. And one part that we did find is many of the children that we spoke to that did the survey and of the kids that are worked with by social workers that we spoke to, that some of the kids didn't need to be in care, that they could have stayed with family, services could have helped mom and dad and support them, but what happens is when the systems get clogged, our reporting shows that then those homes that are really great, because some kids must be in foster care, the physical abuse, the sexual abuse, when you put kids in the system that could stay home, then you're taking up those good homes that could go to the children who really need it. And that is one big thing that we found. We also found emerging science is showing that multiple placements for children, like Dominic had 80, is actually changing the makeup of the brain. Our colleague Eric Adler did that story, which again, was not on our radar, but is starting to pop up in class action lawsuits from Florida to Kansas as being one of the reasons that these night-to-night stays have to go away. And then we found that each year about 23,000 kids age out of the system at 18. And we talked to kids that were basically dropped off at a homeless shelter when they turned 18. Others were told, Judy went to Texas Death Row to talk to a young man who aged out of foster care. And a few weeks before he turned 18, the foster mom came to him and said, "You're about to be 18. I'm not going to get paid for you anymore. You got to go." And he obviously is on death row. And so we found that of the 23,000 that age out, roughly 4,000, and these are studies have shown these numbers, we didn't find these numbers, but 4,000 become homeless. And then when you're homeless, that many of those kids turn to drug addiction, sell drugs, sex trafficking, and then later on, there is the path. So not every child obviously gets on that. Some foster homes are amazing. They're a salvation for some of these kids. But when you're looking at the overall long-term impact, we have social workers telling us that we've got to do something. So I had the opportunity to be embedded in some training in Kansas a couple weeks ago, which the main focus of the training is family preservation and finding family connections. And I got to talk to social workers, which normally they don't let reporters do. So that was really eye-opening to me because they were, and openly saying, we're taking too many kids in. We've got to do something, especially the older teens. Our survey did show that, and here are all the results, but our survey did show that the majority, 40% of those who said they've been in foster care came in between ages 11 and 15. So you can read more of the series. Our goal was to show what these long-term outcomes were. I think the survey was really helpful to allow us to hear from kids we typically don't hear from. So, and it's on kansascity.com if you want to. So I think I kept right at my time, so.
So we're all covering ambitiously a lot of ground in a little bit of time. This convening could probably be its own conference, but we're going to do our best to breeze through this stuff. Exactly. I'm going to talk about 3 levels of intersectionality between child welfare and criminal justice. The first being what's the correlation between child maltreatment and later involvement in life in the criminal justice system. The second being what's the role of the child welfare system and the out-of-home care system in responding to the trauma that youth come into the system often have. And the third will be what are the critical resources and supports that youth emancipating out of foster care need. So first I want to talk about the intersection of child maltreatment and criminal justice, because I think people have a tendency to look at the statistics that are thrown around. Naomi mentioned the 70% figure. Laura mentioned 25% of the prison population, and really blame the foster care system for this. But I think if you dig into the data a little deeper, it gets a little more complicated. So in 2019, the Children's Data Network, which is in Los Angeles County, did a study, and they basically investigated the situations for all 400,000 youth in the state of California who were arrested in 2014 and 2015. And they looked at linked administrative data, so it's a little bit different than doing a survey. And they found that only, maybe this comes as a surprisingly low number, but they found that only 10% of the youth who were arrested before age 24 actually spent time in foster care itself. But what I think they found that was more important was that 43%, so almost half of those youth, had connections to the child welfare system. A quarter of the youth were the subject of an unsubstantiated allegation. 10% were substantiated but not brought into foster care, and then approximately 10% were brought into foster care. What's interesting is that even if the allegations were not substantiated and the child wasn't brought into foster care, the risk factors were still present. The youth who were the subject of an unsubstantiated report were twice as likely as the general population to be involved with criminal justice later in life. Those who were substantiated but not brought into care were 2.3 times more likely, and those who were brought into care were 2.6 times more likely. So as you might imagine, as you get deeper system involvement, there's a greater likelihood of criminal justice system involvement. But I think what this shows is that this is a much bigger problem than the foster care system. Ultimately, this is a child maltreatment problem because youth who never actually come in contact with foster care are having these same outcomes. Next, I want to talk about what is the child welfare system's response. So I think it's important to consider that the changing face of foster care. So since 1999, there's been about a 30% national decline in the caseloads of the number of children and youth who are in out-of-home care at any given time. And that's with the growing child population, of course, since 1999. What that tells us is that the front door is closed for a lot of youth, so those who are making it through the front door often are presenting with a higher level of acuity. They've been subjected to more intense maltreatment, probably for a sustained period of time. So then the system has to respond to the average profile being a youth with a higher level of acuity. And that's where oftentimes within our continuum of care, congregate care comes into play. 75 to 80% of the youth who end up in congregate care were in a family-based placement prior to going to congregate care. That placement didn't work out, oftentimes maybe because the foster family or the relative wasn't equipped to respond to the challenges that were presenting in the youth. And so as a consequence, the youth move into congregate care. And even compared to their peers in foster care, children and youth in congregate care are the most vulnerable kids in the system. They're 3 times as likely to have a mental health diagnosis and 6 times as likely to have a behavioral health challenge. The role of congregate care in the system is to provide the structured therapeutic environment, to provide intensive services, stabilize the child, treat any underlying conditions, and then transition them back to the community. The average stay in in congregate care nationally is only 8 months. But that's going to change, I think, in states around the country. It already has been changing in some ways, but the Family First Prevention Services Act, which was a federal law that was passed a couple years ago, many of you on the child welfare side of this conversation are probably intimately familiar with this law, is going to change the landscape. I think it provides both opportunities to address the intersectionality of child welfare and criminal justice, and also challenges. On the opportunity side, the law allows Title IV-E to be used for mental health and substance abuse services in particular to support children, youth, and families who are candidates for foster care. And so I think encouragingly, we're seeing some states get creative about that definition. I know in California where I live and in Washington State where I work a lot, they're looking at the populations of homeless youth and the populations of youth exiting the juvenile justice system as possible candidates for care, leveraging this new opportunity to deliver mental health and substance abuse services to that population. I also think encouragingly in Family First, the age range for Schaefer Independent Living Program services was expanded. Historically, only youth ages 16 to 21 were eligible. Now it's 14 to 23. However, I think the law is going to present some significant challenges to states and may have some crossover implications for juvenile justice. For one, a lot of the prevention services that I just mentioned are financed by restrictions on the back end for congregate care programs. So going forward, only 4 types of congregate care programs will be eligible for federal dollars. And the law really doesn't invest in alternatives. And so if you have states shutting down group homes or lower level congregate care programs without building up the capacity of the community, in particular to handle some of the children and youth who have that profile of the ones that are typically being served in congregate care, you're not going to have safe places for those kids to go, and the worry is that they will cross over to other systems, run away from the foster home, become homeless, and potentially become involved with the juvenile justice system. Family First also unintentionally is jeopardizing the Medicaid eligibility for children and youth who are going to be served in qualified residential treatment programs. This is super complicated, goes back to like the 1960s and 70s and mental health deinstitutionalization. But basically, Medicaid typically does not fund institutional care for younger people. And this new classification of federal congregate care program is running afoul of Medicaid law. And the concern is that children and youth being served in these facilities will no longer be Medicaid eligible. I know congressional staff are working on this right now. It's something that absolutely has to be fixed. And then lastly, what I'd say about Schaefer is it's great that we expanded the age range and that 14 to 23-year-olds are now eligible, but there was no new resources to finance that expansion. Schaefer's already, in my opinion, an underfunded program. We really need to finance that expansion and follow up with dollars. So interestingly, I talked about how there's concern that there will be implications for the congregate care restrictions on crossover youth going into juvenile justice. I think Family First actually anticipates that. There are two provisions in the law that I think pertain to juvenile justice directly. The first requires that states certify that they won't enact policies or practices that will increase the number of children and youth going into juvenile justice, which isn't really enforceable. I'm not sure what the enforcement mechanism is for that. And then the second part almost tacitly admits that that's not enforceable by saying, well, we want the Government Accountability Office to study the impacts and the rate at which children and youth are now being moved over into juvenile justice because there aren't congregate care facilities available to care for them. So I think it's interesting that the authors of the law almost sort of knew in the back of their minds that there would be some unintended consequences and there would be more crossover from the older youth population in foster care into juvenile justice. And then last, I want to talk real quickly about youth emancipating out of foster care. When I was on the Hill, I helped write the 2008 Fostering Connections Act, which extended foster care to 21. The idea of that law was not to extend dependency, it was really to create a bridge to self-sufficiency. And what we're seeing in states across the country is that it's working, and it's really a protective factor to prevent criminal justice involvement. The National Youth and Transition Database is tracking thousands of youth across the country who are transition-age foster youth and their outcomes. And their most recent report to Congress, I think that was last week, showed that youth who remain in extended foster care at age 21, only 7% are incarcerated, but youth who emancipate out and don't stay in extended foster care at age 21, 23% are incarcerated. So you have over a 300% protective factor here for participation in extended foster care for these youth. I think it's important that all states opt in, and we make these programs accessible for eligible youth, and that we really make them as robust as possible. And then lastly, I want to talk real quickly about workforce. I think this is the missing link in extended foster care right now. We're doing a really bad job of preparing our youth for the workforce upon emancipation. There was an Annie E. Casey Foundation report a couple years ago, Fostering Youth Transitions, that found that all the youth who are accessing transition services, mostly through Schaefer programs, only 1 in 4 are receiving employment programs or vocational training, meaning we're really not delivering the kind of career readiness services they need. I think one of the big reasons that's happening is the largest federal program that funds youth workforce development, the Workforce Innovation and Opportunity Act, WIOA. While foster youth, current and former foster youth, are categorically eligible for WIOA, there are a number of barriers to WIOA access for this population. And as a consequence, only 6,000 youth in the country, current and former foster youth, are accessing a WIOA service in any given year. That's about 2 to 3% of the eligible population. So there's a lot of work to be done on the WIOA end to make sure that those services are accessible and youth can get the academic and career support, internships, and apprenticeships they need to be work ready upon emancipation so that they don't have criminal justice system involvement later in life. Thanks.
All right, thank you, Sean. Hi, everyone.
So I'm Dr. Rebecca Padot. I'm a non-resident senior fellow at the University of Pennsylvania at 2 programs and also an assistant professor at Misericordia University. And I'll be talking to you on criminal justice and foster care as kids go in, as kids come out. And I want to thank Naomi for organizing this and all of you for being committed to this issue, many of you probably in your daily jobs. So as kids go in, one of the ways kids enter foster care is because of a parent's incarceration. And so that's my first point as kids go in. The second point is, as kids come out, is when foster kids leave foster care, they have a risk of entering incarceration themselves. And so kids go in when their parents go in. So there's a 2004 state prison data survey that talked about when the fathers entered prison, 2% of the children end up in foster care, home, or agency. When it was a mother, it was over 5 times that rate. It was 11%. 1 in 30 parents in state prisons have children in foster care. And there was federal data that was just released in August that showed that the primary reason kids go, or not the primary, one of the reasons that kids go in foster care is a parental incarceration. 20,000 kids were going in for that reason alone. That doesn't even include the kids who also have a parent incarcerated, but that's not the reason for entering foster care. So when you look at the total adult correctional population, you see the trend of up in the US and then a recent decline. Because of the First Step Act passed in 2018 and some other current policy trends, we are beginning to see a decline in that population nationwide. That could affect this decrease of kids as kids go in with foster care, but there's a lot of variables. One, as you pointed out, Sean, which is how at risk are the youth entering, the opioid epidemic, right? So this pattern is to be determined. So let me get to the second point, which is really what I want to focus on today, and that is as kids come out. So when foster children leave foster care, they are at increased risk of entering the criminal justice system. A 2004 Bureau of Justice study showed that 14% of parents in state prison reported living in a foster home agency or institute. These were 17% of mothers and 14% of fathers. So now I want to talk about my book, which is The Politics of Foster Care Administration in the United States. It was published by Routledge Press. And it was designed to discover the conditions under which foster care outcomes can be improved. And one piece of this book was looking at this relationship of foster care and criminal justice. So without getting into the methodology, I looked at different child welfare outcome indicators, which you may be familiar with, right? That the federal government collects, states generate this data across a lot of indicators that we want to improve over time. Time to permanency, abuse while in care, reunification without reentry, right? So it's not this revolving door, how many placements, as Laura talked about in her talk. And so I looked at this data, and from that data, I tabulated outcomes that arrived at some strong states and some weak states. And the strong states identified at the time of research design were Michigan and Delaware, and the weak states were identified as New York and Rhode Island. I then went into those states, and I want to say, first of all, that those are not states I would classify now. I would have to rerun the numbers. But I went into those 4 states, and I looked at, I went in and looked at what was going on in these states, right? So I went into cities and towns in all these states, and I did over 55 key player interviews, most of which were with elites. So what that means by elite key player interviews is things like talking to the governor of Delaware, or state chief justice for a state, or the head of a legislative committee, or the executive director of a foster care provider, or the state Department of Human Services director, or the head of foster care for the state. So one of the things I found was that the strong states, which are doing better by our kids while in care, right? So they're not moving the kids lots of times, there's less abuse. I found that they also have problems with their kids integrating into society at higher rates. Now, obviously, there are lots of great success stories, and for people who've been foster parents and done an awesome job, those are, success stories we have. But with that being the case, we have too many kids that are not doing great with outcomes. So here's the data from those interviews of people I talked to. Okay, so the executive director of a foster care provider said, only 50% of my kids will make it, not homeless, not in jail, the rest is really a crapshoot. And again, this is one of the model states used in the study. Another executive director of a foster care provider told me a lot of what we foster care programs do is a Band-Aid. Former foster kids end up in homeless or in the criminal justice system. 30% of the general homeless population is from foster care. Now let's move to the other strong state of Michigan, and this is just some of the data today. This is from the Director of Child Welfare, Catholic Social Services of Wayne in Detroit. Less than 50% will have jobs and not be homeless or in jail. 9 times out of 10, it's cyclical. The system is in such crisis, it's not focused on the long term, and their chance of success is very low. I know I wasn't ready to be out there at 17 or 18. The Michigan State Foster Care Review Board program manager told me 40% of former foster care youth will be okay, not enter the criminal justice system, mental health system, or be homeless. And I'll continue with comments from the stronger state of Michigan. The director of Children's Center in Detroit said 47% of the kids aging out in the system nationally are going into the criminal justice system. The program representative overseeing 7 foster care review boards in Michigan, children seem to be more disturbed from when I first started in child welfare to the 70s until now, something that you said, Sean. Their drug problem has been devastating on the child welfare system. Maura Corrigan, former Chief Justice of the Supreme Court, who actually after our interview went to become the State Department of Human Services Director, the third one that I'd interviewed in Michigan, said, I won't even hazard a guess as to how these former foster care kids will be doing in 25 years. In Detroit, we're now at a 90% out-of-wedlock birth rate. We're only graduating 25% of the kids in Detroit public schools who start as freshmen. I then looked at data that other people had done and put that into my book. So Chapin Hall, University of Chicago study looked at 700 former foster youth over a 10-year period and found that 30% of the males and 11% of the females reported being incarcerated at least one time between age 17 and 18, and many more were arrested. Now remember, this doesn't even fall them long term. This is just data from 17 to 19. The Casey Young Adult Survey followed 1,000 of their alumni from their Casey family programs in foster care and found that 32% of these foster youth had been arrested since leaving foster care. And what's striking about this is they do their own best practice research from academics and practitioners. And so their program is modeled after best practices, and yet so they should have better outcomes than what you would see nationally at some other programs, and yet they still were sending 1/3, not sending them, but we're ending up, right, to as a result of that. And so you see this general trend. And so basically what I concluded in the book was that quick placements, minimal transfers, good permanency strategies, and minimal abuse do not always equate to foster care children ultimately having successful adult lives, growing up with jobs, staying out of the correctional system, not being homeless, and that even the stronger states are having problems with these long-term outcomes. And so we need to focus on long-term outcomes for foster care kids post-care and not just tracking the short-term outcomes while kids are in care, right? So the federal government 30 years ago wasn't even tracking those short-term outcomes in all the categories it's doing now. We now at least have that data, so we can look at different states, how they're performing, et cetera. But we need to follow the child longer. We need to fund following them longer. And we also, this needs to be a consortium as it is now, right? It's a government by proxy system where it's federally funding. States are involved. You've got private and nonprofit partners, which makes it a government by proxy system. And so you've got to involve all of those people in solving the problem. So I proposed a couple solutions, and I have many more ideas for how to solve this. But one is this concept of a volunteer child liaison. And so this is borrowing from the mentoring research literature. It's borrowing from programs that are already done, like the Mentoring Children of Prisoners policy that was federally funded with HHS, also Bureau of Justice does programs like this. And so the focus of the pilot is to establish a human link that mitigates the upheaval the children experience in foster care. And so someone would volunteer, right? And so they would follow the child from the minute they enter the system. And so they're following that child. They're in the, someone in the public who's just choosing to do this. They stay with the child for a 5-year period, assuming they stay within a 60-mile radius. And they are an advocate. They're an advocate for their child. They're their problem solver. They go help them find a computer when they can't afford a computer, that they need to complete schoolwork. They go help them figure out mental health providers. Which one can I use? I have no idea who to call. I don't even know I need mental health help. And so you might say to me, well, doesn't that sound like what caseworkers do? Right? And yes, caseworkers do this, but we know there's very high caseworker turnover. We also know the caseworkers, right, if the child is reunified at some point, that caseworker is no longer involved. We also know the reentry occurs, so you have reunification without reentry. We also know that There's, caseworkers in some states have very high caseloads, right? So they can't have this relationship to track down how to find a computer. And so this volunteer child liaison would be that person. The second proposal in my book is a volunteer youth liaison. It's the same concept, but move the timeline. So as children are aging out, having somebody in their corner who follows them until age 25 at a minimum. Obviously, I prefer much longer, but these are volunteers. How much can you put on them? And so they are the person who's with the child while they're going through all these major decisions. And I know one of the reasons I love being a college professor is because I get to touch kids when they're making major decisions. Should I take out a private loan or a federal loan for college? What job should I do? I care about this population. What should I do? Should I get married first or go to graduate school next? And so this youth liaison does that same concept in that they're helping support that child as they're aging out, getting services or whatever they need, or finding a job, or doing a skilled trade. Whatever it is, they're supporting that person. And I just want to say from personal experience, I draw on this, and that I had a personal experience where I found 3 at-risk youth who visited a food bank. I was volunteering one day, fell in love with them, and followed them for decades. And they have gone through lots of stuff, incarcerated parents, all, you name it, very high on the ACEs scores. And they're doing really, really well. And I was a volunteer in their lives who just followed them over time, helped do these types of things. How do I get a computer? How do I get a swimsuit, right? Just those types of things we worked on for years. And I also want to say that personally, my husband and I have a very small nonprofit, and we noticed over time that the older at-risk youth needed a lot more help into their 30s. And so if we're doing this nationally, right? Nationally, we've decided that kids should be on healthcare up until age 26. Right? And we know that lots of independent children outside the foster care system still have support by their parents, right? They're these college students or even non-college students are living at home, whatever. So we've decided nationally to support non-foster care kids. And so this conversation has to also go to foster children. And so with that, I have my contact information up there in the lower left corner if anyone is interested in reaching out to me. And I want to thank you for this conversation.
Oh, I don't need it. Thank you. Good afternoon, everybody. So thank you, Naomi, for inviting me, and thank you for being here to listen to this conversation. So my name is Greg McKay. Just by way of some background for context, I was a cop for 20 years. I was with the Phoenix Police Department. While there, I worked in the Organized Crime Bureau. I worked in the Street Gang Unit. I worked in the Crimes Against Children Unit. I worked undercover, and I worked homicide. While I was a Crimes Against Children Unit detective many years ago, my wife and I became foster parents to a preschool child that was brutally victimized in major crimes. And so I have that experience as well. So after my career in law enforcement, during my career actually, I was borrowed by former Governor Jan Brewer of Arizona to be loaned to the State Department of Economic Security's Child Protective Services to create the very first child protection system that integrated law enforcement officers to do criminal investigations with social workers. After doing that for about 2.5 years, Governor Ducey was elected and asked me to run Arizona's cabinet agency, the Department of Child Safety, which is 3,000 employee organization that deals with everything from the hotline to investigations to foster care, adoption, permanency, and the like. So when I joined, Arizona was the 50th worst ranked state in America for most major indicators. My first week on a job, I often joke that I found out that our child abuse hotline didn't answer the phone. 35% of callers hung up because they were on hold for so long. We had 33,000 open reports. We had 16,000 plus backlogged investigations that nobody had touched. We had a 45% turnover. We had, on average, 156 cases per every case manager in the organization. We had no service array left because Arizona had grown foster care by 93% in 7 years, which meant there was no longer any foster homes, there was no longer any shelters, any congregate care, service providers, attorneys, and the whole system was saturated and on its side. We had basically 19,043 kids in foster care when I started. And I also had the great news of having a $67 million deficit, and I couldn't make payroll in my first couple months on the job. So that was fun. But fortunately, 4.5 years later, Arizona's hotline was #1 in the nation. We eliminated our criminal case backlogs. We went from 150 cases per person to 15. We shrunk foster care by 25% safely, down to about 13,800 from 19,000. We reduced shelter usage by 78%, congregate care usage by 25%. And with all those reductions, we saw no uptick in reoccurrence of maltreatment or reentry into foster care, which goes to show this system being saturated was causing kids to come into the system that didn't belong there, which is tragic. So after leaving that, just last September, I joined Child Help, which is a national nonprofit for the intervention and treatment and prevention of child abuse. So and one more point I want to just discuss based on Sean's presentation and the great work that they did years ago with extended foster care. In Arizona, one of the things that we have and all systems have is at 18 years of age, it's not a cliff event. You know, I've heard the story, the anecdotal story about they're given a hefty bag and their belongings and they're said goodbye as soon as they turn 18. It's not reality. The reality is that most of these kids are so system fatigued by the time they turn 18 that they don't want anything to do with the system any longer. So it's our job in Arizona, we start working with kids at 14 to get them ready for young adult programs where they get subsidy, college tuition, independent living skills, and a case manager till age 22. But they have to opt in. And systems that are really on their side, of course, see every additional kid as an additional caseload. So sometimes they let them go and they don't try to work them in. So anyway, I want to talk about the trauma. You know, I am not here to dispute that foster care is not the place kids should grow up. Kids who grow up in foster care naturally don't have the best outcomes. But there is also an immense amount of trauma that provokes kids from entering foster care that sometimes is lost in these conversations. So obviously, families should raise children, not courts or executive agencies and governments. And the trauma that results in these kids going into foster care and related attachment disorders and all these things are part of their past, oftentimes. They don't get created once an intervention happens, they land in foster care, although some places obviously are, you know, there's good and there's bad of everything, and some foster parents are not good people, and some are wonderful people. So there are choke points throughout these systems that really result in a poor experience for children, and that's obvious. But, you know, foster care is a sad reality of our country today, and you know, the root causes that bring kids into foster care are very little talked about. You know, we all just want to talk about government intervention, foster care, and the pipeline to prison. We don't want to talk about why kids are coming into contact with police and CPS on a normal basis in their life and what those reasons are. So the path of least resistance, in my opinion, is just to blame government and then absolve everybody of their conduct all the way through the system, to include people who are in prison now who say their stints in foster care caused them to do the bad things that they did. So I think that the data that we talk about is, although I know there's attempts at getting better data, but it's highly anecdotal. And it also can be manipulated depending on what story it is you're trying to tell. So I'm not here to dispute data or dispute that people in prison had bad lives, because most certainly they did. But was it because of foster care? Or was it because of a bad life? Was it because of a bad family? Was it because of broken families and multiple paramours and intense neglect and a mentally ill parent, domestic violence or trauma, sexual abuse or physical abuse, or overall just grand dysfunction that led them to be taken into the care of the state because there was no other safe alternative? So we simply fail to discuss those factors, I think, on a normal basis, and we merely form this nexus between foster care and prison, and that's what we're focusing on. And one of the other things is the crossover youth population that exists. So anyone who doesn't understand that, a crossover youth is one who started out dependency involved, meaning in foster care, and then became delinquency involved and ended up in a delinquency system, or vice versa. And there's been a lot of work in this country about how to prevent crossover youth and those outcomes of being dual system involved. But I would beg to you that reforms in America have provoked that very outcome to occur. We've created a crossover youth problem in this country. So many, many years ago, they had the deinstitutionalization of juvenile justice reform, basically saying misdemeanor and status offenses should never result in any detention or incarceration. I think we all agree that that is true. But it has gone major leaps forward and has now resulted in systems that don't detain children or young adults who have committed major crimes, and they have no opportunity for rehabilitation through the detention system or the juvenile justice system. Now, you could argue all day whether those interventions are healthy or not, but merely putting kids into a foster care system and thinking they're going to get better for it is not the answer. Foster care systems treat parents, not children. So what I had experienced as the director of Arizona's system trying to protect foster youth, my job was not to protect all children in the state of Arizona, although some thought it was. My job was to protect vulnerable, dependent children whom were harmed by their families and who were put in a foster care system for protection and safety and permanency. And what I ended up dealing with was reforms that led detention and juvenile justice systems to offload their delinquent youth into a foster care system with no dependency involvement whatsoever. Meaning, kids had a family, they were not dependent, they were not unsafe by virtue of their home environment or their parent. They merely committed crime after crime, or probation violation after probation violation, and were foisted into the foster care system by a judge who didn't want to detain or incarcerate. And that problem was massive in Arizona. Arizona's group care and foster homes were used for, congregate care group homes were used mainly in Arizona for large sibling groups, or some licensed family foster homes just don't want to take older youth. They feel like the culmination of trauma and life experiences is going to be too challenging for their home. So older youth oftentimes go to congregate care, or behavioral health disorders or therapeutic needs or sexually maladaptive needs, they need to go to these types of placements. But our congregate care populations were being filled up with solely delinquent youth, never having had an adjudication for dependency. So I'll give you a couple examples. I don't have a PowerPoint, but I have stories that you'll probably remember. So this is a list of, just a small list of how utilizing a foster care system as a substitute for detention or juvenile justice is extremely dangerous and brought about disastrous consequences. So I beg to you that potentially these types of youth who are entering into foster care and then end up in prison someday, well, perhaps they entered foster care solely for delinquent reasons and then ended up in prison someday. And obviously, I'm not disputing that some kids who are dependency involved commit crimes eventually because they've had hard lives. So one case, an adjudicated 16-year-old from another state who was ward of another state on probation of another state came into Arizona and committed an armed robbery with a gun of a Subway fast food restaurant. He was arrested, charged with 2 counts of felony armed robbery and possession of a deadly weapon. And instead of detaining, he was ordered into foster care. So a social worker picked him up and took him to a foster placement where there were dependent youth. Number 2, a 17-year-old anally sodomized his 2 nieces, both under the age of 10 years of age, charged with 2 counts of sexual conduct with a minor, class 2 felonies, ordered into foster care, no detention. Next, a 16-year-old ward from another state on probation sexually assaulted his 4-year-old nephew. Again, put into foster care, not detention. So here's another one, 17-year-old and 9-month-old male who had criminal charges for possession of methamphetamine, aggravated assault with a deadly weapon, weapons violations, and repeated probation violations, smuggled meth into rehab and was again arrested and brought to detention, where a judge refused to detain and ordered him into the foster care system. At the pleading of his own parents in the courtroom saying, please, judge, don't let him out. And what did he do? He went to the group home and immediately went to school and obtained a whole bunch of drugs. So here's 3 last sad ones. 2 men were closing a coffee shop in Arizona late at night and walking to their cars when they were robbed and shot to death. And a year later, they finally apprehended the assailants, who were 2 local delinquents who had families and multiple run-ins with the juvenile delinquency system and were forced into foster care instead of detention for a variety of crimes, only to be loose in the community to harm these 2 people. Another case, a child, or I'm not a child, but a almost adult teen, had 7 felonies and was in the court and being begged the judge by the DCS caseworkers to not release this kid back into foster care because he will continue to run away and cause harm. A judge ordered that kid back into foster care. Before the kid even got to the car of one of my case managers, he ran off into the night. Caseworker called him in AWOL. 24 hours later, he did a drive-by and killed a 22-year-old woman in a community nearby. And finally, the last one, a 17-year-old with 9 prior felony referrals with no dependencies was once again released to DCS, and he jumped out of a caseworker's car at a traffic light and disappeared into the night. He raped and murdered and bludgeoned a woman with a rock 2 days later. So my point to telling you these stories is that not only are delinquents being pushed into the foster care system for reform purposes, and they're causing harm to dependent children in foster care, it is not a secure setting. They leave, they AWOL, and they go out and they commit other crimes. And every single one of these at this point are now in the adult system awaiting trials for sentences that are going to be life sentences. So are we doing the right thing by these delinquents? By not holding anybody accountable? So we're not rehabilitating anyone at that age range, and they turn 18 and they end up involved with the adult system. So what are we considering doing in Arizona? Changing the law to extend the age range of a minor to 19. So instead of dealing with these problems, we're going to let somebody continue to deal with the juvenile justice system and now until they're 19 or 20. That doesn't sound like a solution to me. So each of these cases speak to someone who is now or will be in prison someday, but was it foster care that created that pipeline? I disagree. So thank you for listening, and I'm going to take a seat, and I think my friends are going to join me up here for some questions.
Find your name tag.
I don't know.
Oh, it's okay. You just leave it there. Okay. All right, well, there's a lot to digest, and I'm going to take up Sean's suggestion and make this an all-day conference next year. So prepare to come back. Well, thank you all for these presentations. I wanted to just start with this, the causal question that seems to be kind of at the heart of what most of you were talking about. What do we... how do we separate the questions of what's happened to a child before they've entered foster care and what happens to them in the foster care system? And I was wondering, how valuable do you think the anecdotal data is? I mean, Laura, you did these just amazing interviews with these, young men and women in prison. Some of them look back, and some of these young men and women have testified and state houses and Congress and said, my mother loved me, and if I had just, been allowed to stay in her home, I think things would have turned out much differently in my life. And I think we are all, moved by that, knowing now, of course, what's happened to them. We are all moved by that, but. How much do these young men and women understand about what was happening in their family at the time, and the judgments of the adults around them? And do they even have, it'd be interesting, do they even have access to the case files, the reports on what was going on in their families at the time? Because I think we are swayed by these things, but I wonder to what extent you think we should be by these anecdotes.
A couple of the people Judy and I interviewed who aren't in prison and who have just aged out and they're struggling, they've tried to get the reports and they can't get them. Both were in Kansas and a third one in Kansas. So that's one part. Now, one thing that caught me, though, as Judy and I talked to these people, like I said, they did not blame and say the system is the reason I'm in prison. But they did say they felt that it changed them. And I think that is real for them. One young woman named Kisa, she said, I felt like a throwaway, that I was disposable, no one loved me, and basically I learned to love no one else but myself. And so, I think those anecdotes are real. I think that when you find in our survey of nearly 6,000, when it's 1 in 4, there is something that is happening to them as they're growing up. Some of the kids that we former foster kids that we interviewed, they went into care 1-year-old, 2-year-old, 3-year-old, and they were all neglect issues. They were not abuse issues. And one thing that's also telling is the more social workers we talk to, they've said that they believe too many older teens are coming into care. Whether it's the detention issue, whether it's just an issue of mom and dad can't take care of them anymore. 2 of the microscopic looks that we did on 2 inmates, their parents were done, and they called DCF and said, please help me. And yes, it's anecdotal. Yes, it's not scientific what we did, but I do think it would be wrong to not listen to it. And that's one thing that all of the people we talked to said, no one has ever listened before. I feel like I am being heard for the first time, and I think that's important. So,
Sean, I wanted to see if you have any response to that. California, has this, as I learned, a few years ago, has this weird kind of crossover system where foster youth, it is a crossover system where foster youth and youth involved in criminal justice are often served in the same facilities. How did that develop, and do you think that that's part of the problem? And kind of maybe getting into like a little bit of what Greg was talking about. What are we going to do about the crossover of youth? And
yeah, we definitely have a more integrated system than most states. I haven't lived in California long enough to know the statutory history there. But But I think, Family First in particular impacts our state because, like, for instance, we use community group homes, I think, similarly, but not as aggressively as Arizona was, often as a step down after locked detention. So youth exiting locked detention might not be ready to go back into a foster home or to go back home, but the group homes provide a little more structure and oversight. Those are the types of programs that under Family First won't be 4E fundable anymore. And so I think that's a concern. And I think as you've watched states opt into 4E, or opt into Family First, it's been interesting that most of them don't have a lot of kids in congregate care. And most of them are just saying, well, we don't want to deal with this whole transforming our programs into QRTPs. We're just going to forego the federal dollars. And I don't think that's a great way to go at it either, because then there's no federal oversight over those programs either. And you wonder about the fiscal sustainability of a program that's completely reliant on state dollars. What's going to happen in the next recession? How long are those programs going to be reliant and able to rely on just state-only dollars?
And how common, and this is for any of you, how common is what Laura was saying about, you have, youth who are in trouble and parents who are saying, it's up to you, state, to take care of them. I mean, that's something I don't think we talk about at all when we're talking about foster kids. We're really talking about, the state coming in and against the parents' will, removing the kid. How common is it for a parent to throw their hands up and say, it's somebody else's problem now?
Yeah, so it goes both ways. Sometimes parents are in the courtroom pleading with the judge to detain their child, which is painful because they know that time is of the essence, and once their child ends up in that adult system, they don't have any control at all anymore. So there's some like that, and then there's some who kids get put on the GIPS monitor, an ankle monitor on probation, and go home with mom or mom and dad or dad. And they cut the monitor off and they run out and they violate and commit other acts, and they go back in front of the judge and they put the monitor back on and they send them home. And it's a rinse and repeat. So lots of times probation or the judge will say, we'll put that child into foster care because the parents can't handle their delinquent behaviors anymore. But I would beg to you that once it's gotten to that point, why is the foster care system going to police them? And why are they not in a detention system? So, parents juggle both ways. Sometimes they're pushing it off on the government. Other times, they're asking for help. And in Arizona, some parents actually will use the independent living and the young adult programs, and they'll end up getting their teen into the dependency program to financially benefit from independent living subsidy and college tuition and all these things. So there's ways to game the system. And Sean mentioned fiscal too, and all those stories I just told you about the juvenile justice system using the child foster care system, it was largely fiscally motivated. It was motivated by reforms and pushing of reforms down through the states, and it was motivated by fiscal. In other words, county detention, county probation, county juvenile departments did not have the pocket of Fed money mixed with general fund dollars to care for these kids. So they were offloading the expense and the problem on the foster care system, and then kids get harmed in foster care. I can't tell you how many videos I've seen over the years of some foster kid being beaten or hurt by some other kid that's in the environment that is a pure delinquent youth. So something needs to be done.
Rebecca, I wanted to ask you, in your research, when you were looking both at the strong states and the weak states, what extent did family court enter into the effects for these kids? And were there more and less effective family court systems that you saw? I know some really do separate the delinquency from foster care. In other states, it's all one big family court question. Were there any kind of signs that there are more and less effective ways to do family court?
One of the variables I found generally was in the quality of public managers, and that included judges. So I didn't see a difference in what type of court. Was it family court, drug court, et cetera, where this ended up. I saw it in was the Chief Justice or other judges who had oversight of the child welfare area actually doing a great job. And so you saw in Michigan, the Chief Justice was phenomenal. And then I think it's very interesting in Rhode Island, when I tried to interview the justice oversee it, it was the one interview that lost my interview request over and over and lost it and lost it and lost it. And then when I went into the state, I learned, oh, this is what everybody else is facing with and they even had a term for the guy, Judge Jeremiah for life, they joked about, because it was so atrocious in that the view of the data was that he wasn't protecting kids. So I saw it more not systemic as the quality of public managers that were in the judicial system.
I think on the courts, that training that I just was embedded in really opened my eyes, especially for Kansas, how involved the courts are. And I was sitting with social workers for the state. They were investigators of allegations, and they wanted this mom to have her child back. And they had recommended it at every turn. You know, she has support. She's done everything we've asked. There was never a substantiated allegation. She and her husband got in a domestic argument, not physical, and they were removed. And everything the social workers did, the court still said, nope, they're going to be removed. And they are more heavily involved in Kansas and Missouri and the states that I've looked at. So I think that's one thing that, I know I'm going to spend more time on, and that they're a big player as far as in Kansas.
I want to turn to this question that a number of you addressed of how to sort of extend the time of kids, in the system somehow. And obviously, Greg, you were saying, the incentive is, to have them opt out, because then it's kind of less of a caseload. Obviously, it's going to get put into another system, as we've seen here. But are there states where you've seen successful efforts to get kids to stay longer in these transition programs? Are there programs that you think create more of an environment where these kids feel like they have more autonomy, where the independence is there, where there's more of a ramp for them than what we're seeing in a lot of states now?
We have in California the uptake rate for our AB12, as our extended foster care program, is extremely high. It's like as high as 90% in some cases. I think it's because California is an expensive place to live, and youth know that they get resources and support services if they opt into care. We also have a pretty robust transitional housing program system that's available for those youth. So they really see it as a door to support and services. So our rate of uptake is very high.
And what does that transitional housing program look like? Are they, do they feel safe and protected in that environment, or is it
some programs are better than others.
Is it really like more of a homeless shelter feel for young
people?
No,
they're typically, a lot of them are converted group homes where you have, say, 6 to 8 youth living with wraparound service. Sometimes there's a host person living on site too. But the majority, because there's capacity issues with our transitional housing programs, we don't have enough. I think we have more than most states, but not enough to meet the demand. So to answer your autonomy question, most of the youth in the state are basically living independently, and they take the check and find, market rate apartment or something like that. So that works for some kids who are more ready to be independent, but then their access to supportive services can be a little more challenging. And the stipend isn't enough to, get all your basic needs met, unfortunately.
One thing I think Judy and I found is there's a growing number of kids who've been in care that are aging out, and they're becoming advocates to help other kids that are aging out, to let them know the resources. And we found a real success story in Indiana of a young man named Josh who had been in foster care since the age of 2. At 13, he went before the judge and said, I just want to age out. I'm tired of calling people mom and dad only to be moved again. And so he made a conscious decision. But at age 12, one of his foster fathers came to him and said, you need to know what is available to you. You need to know that you can stay in care. You need to know that they will help you with tuition. They will help you with a car. And now he's doing that for other people. He's about to graduate from college. Another statistic out there as far as college, roughly 3% of former foster kids will graduate from college. Josh is bucking that every audit, every chance, and he's doing great. But his life's work now is helping other kids as they age out, and he's having success with that. So.
I do want to sort of put in a plug here for the fact that this is work that could be not only done by the government. I've visited quite a number of centers and programs that are Some of them are faith-based, but some of them are just private. And you have a center that is providing laundry facilities for young people, and in the same place where they can access job training programs or information about how to get a driver's license. And they have counselors where they will go with you to help you find an apartment. Maybe you'll be taking government dollars, but you'll be receiving your counseling and that one-to-one service that will probably feel different from the caseworker who has been supervising you as you've been in foster care. And to the extent that you can sort of get those more out of private organizations, I think you might get better results for some people might be more willing to stay in the system if the system looks a little bit different than the system that they've been in up until that point. I think we have so many topics we covered. I really want to just open it up to questions from the audience now. We have somebody who will come around with a microphone. If you could please make sure to state your name, and also please make sure to ask a question. Look, right there we have a man who has a question, I can tell.
Good afternoon. My name is Richard Wexler. I'm Executive Director of the National Coalition for Child Protection Reform. So my question is this. You've dismissed, essentially, Naomi, the lived experiences of the foster youth who told their stories in Laura Bauer's series. So what about the studies, like the massive studies of typical cases, not the horror stories, that show children left in their own homes fare better than comparably maltreated children placed in foster care? What about the studies that show 30% of America's foster children could be home right now if their parents had decent housing? What about the other bunch of studies which show that even tiny increases in income reduce neglect? Raise the minimum wage $1 an hour, reduce neglect by 10%. If poverty isn't the problem, why is cash so often the solution? And finally, I invite people, since Sean is particularly good at spinning statistics selectively. Now, I don't have a response to the ones he did here today, but I've got a response to the ones he did previously.
This is going to be a question.
On nccpr.org. I asked you several questions, but here's one more. Why are there no former foster youth and no people of color on this panel?
Okay. So thank you for the question. I'm not going to address all of them right now. I am not dismissing the stories of former foster youth. I do think, as a mother of children, as someone who has known children for a long time, that often the recollection of somebody who is 10 years old about what their family was like when they were taken away might not be the most accurate depiction you can get of a child's story. And that is one of the reasons why I was curious when Laura said that these are people who could not access their files even after they had aged out. They could not find out what an investigator came and found out when they came to that person's family. I think that that is a real travesty. I think that young people should be able to have access to that information because their own recollections might not match up with the reality that unfortunately adults faced when they came to visit that child. I do think that the research is very mixed on outcomes for kids, whether they age out, whether they're reunified, or whether they're adopted. I encourage you to look at other kinds of research. There's a woman named Sarah Font, for instance, who's at Penn State. She recently looked at data in Wisconsin that measured educational outcomes and employment outcomes for kids who had aged out, who had been adopted, and who had been reunified. And she actually found that the worst outcomes for education and employment were among kids who had been reunified. I don't think that's true in every case or in every instance, but I do think that the research here is mixed. Anyway, I don't know if you want to, Sean, you were maligned, so maybe I should let you respond. But
I'm good.
You are good at spinning
I can just
statistics.
jump in and say that's a family preservation conversation, which I think is a whole different panel.
Yeah.
And this is more of a criminal justice. And the discussion here is, we have 62% of people in foster care because of neglect. And could you provide them more family preservation services so that they don't end up in foster care? And that's a very valid discussion and something that that needs to be there, right? So should these people even be in foster care if they were actually giving a lot of the resources that are available to them and funded for them, which is an issue, right? Is housing actually funded even if we have the resource for housing for people? And so that's a different conversation, family preservation.
You have other questions?
I could speak a little bit of
Oh,
that.
sorry.
Okay.
Oh, do you want to? Go ahead, Greg.
Well, just real,
add
just real quick. I mean, yeah, I mean, naturally, there's going to be situations where somebody would have been better off had they not been removed, and the state exercised its removal authority on somebody. You know, so that's a very long conversation on what risk assessment models do, but you know, oftentimes it comes down to the risk tolerance of jurisdictions. And like Laura was just talking about earlier, the judges, kid comes into the system for A, and then a judge tacks on 5 additional encumbrances on the family to meet a case plan before they can return. So throughout these systems, there is this fear component, and that fear has been created through media coverage, necessary, but media coverage evokes it, litigation evokes it, people's personal, moral, and own feeling of liability when it comes to these things. And I mean, this is King's X. When you're standing in somebody's living room and the situation rises to the level of, should I remove or should I not remove? You know, you could remove a child, put them into care, and find out that the mother committed suicide and say, oh my gosh, we shouldn't have done that. Or you could leave the child there and leave, and 2 days later find out the mother killed the child and then herself. So it is a tenuous situation to be in. It's not so easy to just say, hey, kids are better off left with their birth families. Kids are better off in foster care. You really have to look at every case, you know, as it under its own merits. So that's all I have.
Right here, if we can hit that microphone.
Thank you. I'm Jennifer Jacobs with Connect Our Kids. It seems like all of you have mentioned aspects that apply to mental health and trauma. And it may be that a child is in foster care because of something that happened in the mental health trauma field, or it may be that foster care itself contributes to that, or both. It's interesting that, of course, from your study, Laura, that 3/4 of the prison inmates surveyed were not in foster care, and yet they still ended up in prison. So it may be that foster care is part of a multifaceted system that is needing a stronger addressing of mental health and trauma. And I'm curious from any of you, really, but maybe you, Greg, particularly since you worked in the system directly, how do you feel about the opportunities that the foster care system itself is providing to care for these children who clearly have higher levels of mental health needs and trauma than the average population? Could any of you speak to that?
Yeah. Yeah, and the level of acuity is definitely higher. As somebody who worked 20 years in major crimes, homicide, I can say that things that happened 15 years ago, we would talk about and think about for months and years to come. And it seems like the egregious events that happen today, it's just Wednesday. It's really sad. And kids are feeling this especially. The behavioral health side of the systems is really varies. Some systems are more robust where the child welfare system and the Medicaid systems are connected and have a better response for their kids from a behavioral health standpoint. But just to give you an example, in Arizona, up until recently, Arizona, if you took custody of a child, put a child into foster care, and then had certain behavioral health deliveries that needed to happen, the Medicaid was handled by another entity and private providers that had profitability statements. So when you look at, then everything comes back as not medically necessary or not a qualified expense. So you had a foster care system responsible for a child's welfare, permanency, and recovery and behavioral health needs without any control of the Medicaid dollars that are going to pay for it. So we just did a legislation solution on that, but it varies from state to state, but it's a huge component of the system, and they have to be integrated to a certain degree to make sure it's done well. Now, I'll let you guys.
I would just say, like, from the foster parents I've interviewed, the difficulty that they have in accessing those behavioral and mental health services. Often you find foster parents who will pay for those out of their own pocket because they are so frustrated with the system, and they find that the caseworker can't help them, and they go before the judge, and they try to tell the judge, I can't get the services I need for the kid. But yes, there's often a big disconnect between what the system thinks that the child needs and how readily the system is going to be able to provide it.
And for some of the kids that we focused on, yes, they may have had trauma before they got in the system, but then the trauma only compounded several times when they were in the system, and that wasn't treated. And one young woman in prison told us that the first time she ever got mental health treatment was in prison. And so I think there are several states that aren't doing enough and to address the mental health. Now, I think Family First money, some of that is to provide for mental health treatment of the whole family. But I do think mental health is a big part. Many of the ones we talked to and many of the ones that wrote on the survey had felt that they needed that treatment while they were in care and they didn't receive it. But that's just from them.
I would encourage you, by the way, Laura's series has a video component to it, which we couldn't get to today because we have a lot of material to cover, but the videos are quite moving, and it would be great for you to be able to hear kind of firsthand what's going on in their lives. Other questions? Yes, right there. Get a microphone.
Thank you. I'd like to ask if any of you looked into the issue of LGBT discrimination, which could be both kids ending up in the foster care system because they're LGBT and rejected by their parents, to the increasing laws that prohibit LGBT people who want to be foster parents.
I know it did come up in our series. When we were working on it, we noticed or were notified of a suicide in the middle of Kansas of an LGBTQ youth, and was put into a foster home that did not go well because of that situation. And when she was put back in, took her own life. And we didn't, many states are trying to provide those protections. We interviewed a transgender teen, 20, in Indiana, and they felt that all of their problems were because adoptive mom could not accept the gender thing. So I do think systems are really seeing that, and they're trying to pass laws, I know, but we didn't really get into whether that was causing the trauma other than those two situations.
I do think what you see in a lot of foster youth is a very complex array of psychological problems, and it's very hard to sort out what is, the gender identity issues from depression, from anxiety, and I think because the behavioral and mental health system that we're offering these kids is so broken, we're not treating all of these questions very well, and so I would just hesitate to say she said, that it was that we're blaming the suicide on this. Right. On this mismatch between what the parents wanted and how she saw herself. But suicide is obviously something very complicated, and we don't want to just jump to that conclusion. I do want to just say, because I think it's important to make this distinction, there is a lot of conversation now about the laws around what faith-based organizations are supposed to do when it comes to placing kids, but we do not have laws that are preventing LGBTQ people from adopting or fostering fostering in this country. There are agencies that serve people from all walks of life, and so I don't know of any state that has passed any law that suggests that LGBTQ people should not be able to foster or adopt. Okay. Other questions? Okay, great. All right, well, thank you so much. Please help me thank our panel for this great conversation.